Good morning, everybody, and welcome to today's Business Support Series webinar, and thank you all for joining us. My name is Patrick Sullivan. I'm the President and CEO of the Halifax Chamber of Commerce and your host this morning. Well, we've had quite a couple of weeks here in Nova Scotia, much like all other provinces, thankfully, we're not seeing the increases in cases that are occurring in some provinces like Alberta and Saskatchewan, but clearly we have experienced in the last week or so a bit of a surge. We are now remaining in phase 4 until October 4th to give and more time to everyone to prepare for the upcoming vaccination policy. I know this is going to be confusing today for me to say vaccination policy. This is the government's vaccination policy. The government will be releasing more details on how exactly the policy will roll out and which locations it will impact in the coming weeks, although they've released some of that detail now. In the meantime, our guest today will help us prepare our own policy, so a policy for your workplace. We know this is a sensitive topic, but we ask that you remain respectful of our guests who are volunteering their time to support our businesses at the Chamber as we navigate through this next phase of the pandemic. And thank you to everyone who has already submitted questions for our presenter. When we get to the Q&A, please feel free to type your questions into the Q&A box and we'll answer them as time allows. Our first guest today is Kourosh Rad, owner of The Garden, a wonderful restaurant at 1446 Queen Street, just off Spring Garden Road. A first-generation immigrant from Iran, Kourosh has overcome many barriers throughout his entrepreneurial career, the last of which has been owning a restaurant during a pandemic, which I suspect he didn't see coming. However, Kourosh's values-based approach to entrepreneurship has helped him build strong bonds with community groups and organizations, provide a supporting environment for employees, and attract the best talent on the culinary scene. He'll start us off today by giving us his perspective on the vaccination policy as both a small business owner and a citizen of Halifax. Very pleased to be joined by Kourosh Rad today and love visiting his location at The Garden. I should tell you, Kourosh, I was there a few weeks ago. My wife had a fall. It sounds terrible. She had a fall, she twisted her ankle, she was led into emergency, and they wouldn't let me come in to emergency. So I had to find some place to go. So I went to The Garden and sat on your lovely patio and had a meal while my wife was at emergency, which sounds terrible. But the meal was great, and she's now walking again, so it's all good.
Well, good morning, Patrick. Glad to hear that she's doing better, and I think that is the essence of the restaurants, and that's what we had missed through the pandemic. I was asked yesterday why I love doing what I do. It's because we are a place that people come here to celebrate, they come here to mourn, they come here to wait for their loved ones, they meet their loved ones for the first time. There's so much that happens in the life of a restaurant that, you know, what you just told me is exactly why we do what we do.
Yeah, well, that's great. Well, welcome. And how are you doing through the pandemic, and what do you think of the vaccination policy?
Well, I'd start off by saying that I'm grateful to be living in Nova Scotia, to be able to have only 4 shutdowns, not extended ones like many other provinces did. I think a lot of it goes to the thinking that went behind, taking it slow, taking it, the uncertainty has been very difficult for us. I think the biggest challenge has been communication part of things. I think there has been a lot of last minute changes that has been very difficult for us to adapt. And as we are going to an uncertain future without wage and rent subsidy, those uncertainties need to be resolved as soon as possible. So it's been a difficult go for sure. At the same time, by the virtue of, just being here, the community coming out, supporting us, we're making through. In terms of the vaccination policy, absolutely, it's a no-brainer. I think even in the States, restaurants have band together in different cities, requiring it without any legislation. We've been waiting for this to be happening. We saw it happening in Montreal and in Quebec first. We were hoping that it would happen here sooner. it's here now. We are embracing it. We are definitely looking forward to implementing it and making sure that we keep our community safe.
That's great. Now, are you concerned about enforcement or the fact that your staff will have to ask people? How do you feel about this?
100%. I think the enforcement piece is going to be the hardest part. Our staff, I feel bad for them already, they've already been asking people to text that number at the door for contact tracing. That it's been difficult in itself, but this is going to be a whole other level of difficulty. I think that's definitely going to be a challenge. I know other cities have had QR codes and such. Here we just, at the same time, I say that I feel like, 80% of the population is at least one dose vaccinated. I think we're going to see, if that's the ratio, 2 out of 10 coming in, not being vaccinated, I think we can handle that. And I think a lot of people are going to be understanding. How are we going to face the difficult situations at the door when we have to turn people away? I don't know yet. That's going to be an interesting challenge.
Now, did you announce a policy before the government did, or
so when they announced the phase 5 is going to start September 15th, knowing that that's happening, we felt that it's necessary for us to ask our staff. We have a lot of music performers that come in, for our staff and the music performers to be vaccinated. It's both to keep our, we are opening up, we are going to have no masks. Yes, they're going to have no masks. So keeping our staff safe was a top priority, but also keeping our guests safe was also a priority. So we said as of September 15th, all our staff need to be either fully vaccinated or get tested weekly. Luckily, that policy was put in place after discussions with our staff. They were in full support of it, and now we have everyone fully vaccinated. No one needs to get tested. So yeah, I think we understand. We've been at the forefront of this. We know what another shutdown means for us. We are supporting this 100%. Our staff are supporting this, and this policy was put in place after conversations with them.
And did you get any negative feedback when you made that announcement? Maybe not from staff, but from customers?
Oh, yes. Our Google reviews started blowing up. Our phone, a few people started calling in. Facebook was just vicious. I think Facebook is breeding so much hate that it's unbelievably toxic. I think the most amount of toxicity was on Facebook. Instagram was the same thing. We lost a couple of hundred followers on Instagram. I think the worst one of all that I had to open a file with the Halifax police was a gentleman called from Sydney, Nova Scotia. I thought a lot of the hate is coming from other provinces, but someone called in from Sydney, Nova Scotia. You could see their number calling from Sydney, saying how their family and they used to come here every Friday. Obviously a made up story, and how we don't deserve to be alive, and how they, he wishes us to go under, and like all these things that we're just like, our staff were taken by a bit of a surprise. So that was a little nasty and very unfortunate to see. Still, we get messages every now and then. But yeah, it was expected a little bit. It was a little more than I expected, but we didn't want to make a political statement. It was just what was right for us. And last I checked, we have, within the boundaries of our business, we can do things that are right for our business. So
yeah, well, and obviously you have a private location, right? It's a business. Yep. It is, your location. You get to a large extent make the rules. But I think the government. Are you happy the government's now kind of providing cover for business by implementing this?
100%. Yeah, they had to do it. They had to do it in court. Like, we were surprised that they're not asking for it as part of phase 5. That was from the beginning. That was a surprise to us because that would have made our lives so much easier. But now that they have recognized that, now their phase 5 is tied to double vaccination for guests to come in. So it's definitely the right step. I wish it had happened earlier, but it is what it is. It is. We are here. We are. I think we are all learning through this, and the government is making choices that are informed by different people. So I think we're on the right track now.
Right. Well, thank you very much for your leadership, and thank you for supporting this policy. We are in favor as well. I should be very clear. The Chamber is absolutely in favor. And I do believe that it is the minority. I think it's greater than 80% now of eligible people who are vaccinated. And I know, speaking to the folks that are in charge of vaccinations, the normal vaccinations have been running at 5,000 a week, and last week they went up to 15,000. So we're seeing many, many more people get vaccinated. So I think it will be a small percentage of the population who are unwilling, and a very, very small percentage of the population who are unable to get vaccinated.
I will just add one more thing. It's a privilege to be able to go out, as we saw last year. It's a privilege to go to a restaurant, and we need to pay for that privilege through collaboration, through kindness, through understanding of each other. It's not a right that we have. We have to be binded with certain rules to be able to enjoy this amazing thing that we are creating together. A restaurant is a public space, and it needs to be respected, and it needs to be held at a high place. So I just ask everybody to be kind. I will add this as well. The amount of hate outside of the vaccine policy, people need to be kinder. What we see right now is so much unkindness. We get it. Everyone has had a hard year. Don't bring that to the restaurant, because we have had the same thing. Come here. Let's celebrate things together. If we have a disagreement, put that at the door. Come in. Let's enjoy a drink together, and let's have a meal together.
Right. Well, I would love to enjoy a drink together, so I will focus on that. And thank you, Koresh, for joining us. I mean, thanks, you can see from your background what a beautiful restaurant it is for those who haven't been there, with chandeliers and spectacular locations. And as I said to Koresh a few moments ago, some of the most beautiful bathrooms in the city of Halifax. So thank you very much for having such a beautiful location that people can enjoy and will enjoy moving forward. So thanks for joining us.
Thanks for having me. Cheers.
I know you got a business to run, so I'll let you go.
Bye-bye.
Okay, thank you very much. Thanks, Koresh. Okay, well, thank you very much, Koresh. And businesses have had to bear, frankly, far too much responsibility over the last 18 months. It is the Chamber's position that it's now time to shift that responsibility from businesses to the individual. But thanks to people throughout Nova Scotia, our cases and deaths, sadly, have remained very low. And I do look forward to visiting your restaurant and other restaurants. Now on to our next guest. Tanya Tinsky is a senior advisor with MC Advisory, a strategic advisory service for business and the public sector. Tanya has extensive knowledge and understanding in all areas of human resource management at both the strategic and operational levels. And I will turn it over to Tanya to lead us through the next portion of our presentation.
Great. Thank you so much, Patrick. It's my pleasure to be here with you today. And thank you once again for inviting us back. Before we get started, I just wanted to walk you through the agenda of the remainder of our workshop here today. So we could advance a slide. Erica? Maybe? There we go. Great. So to start off with, my colleague, Karen Lockerbie, who as well is a senior advisor with MC Advisory, she will lead us through a broad public policy framework. So she will be looking at it from the perspective of a national, global, national, and local context of COVID and immunization. And then she will pass it over to Ian Pickard, who will provide the legal landscape for our conversation today. And then the presentation will come back to me, and I will take you through a very practical walkthrough of developing policy in general, but overlaying and integrating the immunization policy into that part of our workshop, and then talk about any other considerations that we may need to be thinking about moving forward. And we're hoping that we'll have 10 or 15 minutes at the end of the presentation to have some questions. So before I hand it over to Karen, I do want to acknowledge the land upon which I'm located is unceded Mi'kmaq territory, and I pay my respects to the Mi'kmaq people of this territory, past, present, and future. So I will pass it over to my colleague, Karen, to take us through our first section. Thank you.
Thanks so much, Tanya. So hello, everyone. It's a pleasure to be here with you today, as Tanya said. And like me, many of you are probably staying tuned to the regular media briefings by Dr. Strang and Premier Houston to see exactly what the latest updates are and will be. So that's why we're going to begin this presentation today with an overview of the public policy context of COVID-19 and vaccination, because it's really the public policy that's shaping our day-to-day experiences living with COVID-19. So broadly speaking, public policy is a course of action, laws, and rules that are created by government in response to real-world influences. And in this case, that's the COVID-19 pandemic. And because pandemic public policy is ever-changing and broad, and there are many different perspectives on vaccination, my goal today, as Tanya said, is really just to give you a high-level overview of the public policy context that's shaping the more specific legal and policy workplace considerations that Tanya and Ian will address with you shortly today. So we're going to begin with the global context, and it's already our second year of the global COVID-19 pandemic. And although we do see vaccination numbers increasing, overall governments in most countries are still struggling to fully vaccinate their populations. At the recent G7 summit in July, world leaders of the 7 wealthiest countries reaffirmed their commitment to reaching at least 70% vaccination in their own nations. And they pledged more than 1 billion doses of vaccine to assist poor nations, and also committed to ongoing research funding and initiatives to increase vaccination uptake and to try and address emerging variants in an effort to bring COVID-19 closer to an end. So we know that international organizations such as WHO and government and manufacturers are continuing to engage in efforts to get COVID-19 under control through vaccination programs. But so far, only 42.3% of the world's population has received a minimum of 1 dose. 5.76 billion doses have been administered globally around the world, and only 1.9% of populations in lower income countries have received just 1 dose of vaccination. And these ongoing vaccination challenges are largely attributed to production costs, anti-vaccination activism, vaccine hoarding in certain countries, new and emerging variants, and the fact that children under 12 are still ineligible for vaccination. And we're also seeing a trend globally that people are generally beginning to grow weary of COVID-19 protocols and restrictions. We are beginning to hear citizens become more vocal about relaxing vigilance on physical distancing, mask wearing, and other public health interventions. And we're also beginning to hear many now calling on governments to return things to normal, particularly with the increasing vaccination rates. And you also hear the opposite view, that some people are nervous and they would like governments to continue to proceed cautiously with at least some safety protocols remaining in place or some restrictions in place. And we're seeing that some countries, but not all, for example, Australia is in firm border lockdown. We're seeing that in some places, domestic and international travel is beginning to increase again, and restrictions are easing, and governments are attempting to progress vaccination programs and reopen their local economies more fully through the introduction of different types of variations of proof of vaccination policies to further spur travel and tourism, keep borders open, and revitalize local businesses and economies. So moving closer to the federal view here in Canada, the federal government has stated that its public policy objectives of its COVID-19 response and vaccination program are to minimize serious illness and death, to limit societal disruption, reduce the burden on the healthcare system and resources, provide for greater sustainability and economic growth. And the government has said that vaccination is the most effective tool to reduce the risk of COVID-19 transmission for Canadians. So Canada's vaccination rates are actually some of the highest in the world. And the federal government has made clear that it's their opinion that vaccination uptake must continue if we're going to avoid further serious waves of COVID-19 and thereby the introduction of stronger restrictions again. The federal government continues to strongly recommend vaccination for all eligible adults, but as we would expect, they're not mandating or making vaccination compulsory for all Canadian citizens. That said, the last month in August, the federal government did announce that as early as the end of September, vaccination is going to become mandatory for all federal public servants, federally regulated air, rail, and marine transportation sectors, as well as for certain travelers. And this will include commercial air travelers, passengers on interprovincial trains, and passengers on large marine vessels such as cruise ships. The federal government has said that it's currently working with stakeholders to determine how those requirements will be implemented, but they have already referenced proof of vaccination and other means such as testing and alternatives, and have clarified that accommodations will be made for people who cannot be vaccinated for reasons such as medical reasons or other ineligibilities. In August, the federal government also announced that they are working closely with all of the provinces and territories in Canada to implement secure and standardized proof of vaccination in partnership with those provinces and territories. And although, as Patrick pointed out at the beginning, we're calling these policies, early indications suggest that these proof of vaccination policies may be made mandatory by governments in one way or another as a condition of entry, attendance, or participation in non-essential activities. And just roping off there in federal travel, we know now that Canadians are allowed to return to Canada from abroad without the need to quarantine or have post-entry testing like we used to, as long as the traveler uploads proof of at least 2 doses of approved vaccination on the ArriveCan app and provides negative COVID-19 testing within 72 hours of boarding. And the government has taken a strong stance on foreign travelers entering Canada now, saying that those who do not have any vaccination or only 1 dose should not enter Canada at all for any non-essential reason. So moving to the broader provincial, territorial, and provincial level across Canada, we now see that provinces and territories are in the process of either tightening up restrictions or loosening restrictions, having regard to the evolving circumstances in their own regions. And all are in the process of continuing to roll out vaccination programs and phase reopening plans, though we see some needing to move backwards. While immunization continues to be strongly recommended by governments in every province, again, provinces are not mandating vaccination for all citizens. But again, we are seeing a trend of various provinces beginning to introduce certain vaccination requirements, again, across the public service, for example, or announcing the impending introduction of proof of vaccination requirement to participate, again, in non-essential activities and events. So I'll just run through a couple of examples of what's happening. The day before, Saskatoon announced that its government employees will be required to provide proof of vaccination no later than October 1st, or must provide negative testing. Our friends in Alberta have recently redeclared another state of emergency and are currently reimposing very strict and wide-sweeping measures to combat a very disastrous 4th wave in that province. And that includes a proof of vaccination program that, interestingly, places more rigorous restrictions on those businesses that will not require proof of vaccination from their patrons. Looking closer here in the Maritimes, Newfoundland has introduced the introduction of vaccination passports for non-essential activities shortly. And New Brunswick has announced that from next Wednesday, anyone who works or lives in communal settings such as assisted living facilities or shelters will be required to be vaccinated or will have to wear a mask and be tested for COVID regularly. Back in May of this year, there were some administrative fairness principles developed by the Canadian Council of Parliamentary Ombudsmen to help guide provincial governments and government organizations in developing implementation vaccination proofs and policies. And the key aim of that guidance is to help provinces ensure that they're fair in the application of such policies and that they won't be oppressive or unreasonable barriers to local citizens accessing government services. And then we're also seeing a rise in universities, as well as a number of private businesses already coming out in front of the government formal announcements, and they're publicly declaring support for proof of vaccination. And we know that our Halifax Chamber did a survey here in Halifax, and it was over 80% of respondents to that survey were in support of proof of vaccination or similar policies. But we've seen some of the big companies come out with a strong view. For example, some of Canada's top 5 banks companies like Rogers and the Canadian arms of Twitter, Google, and Netflix. The Halifax Wanderers have come out with statements. Our colleagues here in the restaurant industry, as you heard earlier, gyms, as well as local universities, for example, Dalhousie, St. Mary's, Cape Breton University, just to name a few. So certainly it's a very live topic at the moment. So moving even closer still, specifically here to Nova Scotia. Here in Nova Scotia, as you all heard earlier this week, unfortunately, there has been an increase of COVID cases. And as a result of this, our provincial government recently announced, as you would all be aware, that phase 5 of reopening is now going to be postponed until the 4th of October. And at that time, gathering limits and mask mandates will be dropped, but proof of vaccination policies will be introduced for all non-essential activities and events. Now, having said that, our government has been very clear that that will, possibly change depending on what the circumstances are on October 4th. Depending on evolving statistics and cases, there may be further delay or changes. But at this time, Premier Houston and Dr. Strang have said that Nova Scotia will be instituting the proof of vaccination policy province-wide for all non-essential services and activities, but that the government will not be mandating that those businesses and organizations require their own employees to be double vaccinated. Instead, our provincial government has said that businesses are strongly encouraged and may be required to implement their own policies. And the government has provided, as Patrick said, some information about what we can expect, but they've confirmed that they're still finalizing the official details. So we'll have to wait and see what formally comes out for the 4th. But what they appear to be trying to do is balance a number of considerations. So things like protecting public health, minimizing the risk of further serious outbreaks, while also respecting that individuals have a right to choose whether or not they ultimately wish to be vaccinated, and also the need for people to be able to access essential services. And, very significant to all of this is them trying to balance the fact that employers have an obligation to make their workplaces safe for their workers and their patrons, and that this may need to include establishing vaccine policies or proof of vaccination policies or other measures to help, comply and also to reduce the spread of COVID-19, and that those employers all may have different specific circumstances to their sector, to their particular operations or their own workplaces. So the provincial government, again, has said that they will be looking to businesses to implement their own policies in that regard. They have confirmed that those that have a valid medical reason or behavioral reason will be exempt from the policy, as will children under 12 who are not eligible to be vaccinated, and also that there'll be a bit of a grace period for children who are turning 12 this year. We're going to have to wait and see exactly, again, what the government comes out and says, and whether those, guidance policies are included as formal health protection orders, protocols, or directives. If they are, then they're arguably enforceable, and it's possible that that enforcement could either be achieved under the existing measures for the Emergency Management Act, where in certain circumstances can be enforced by police, but potentially more likely that it'll be enforceable by the safety regulator under occupational health and safety legislation. And again, enforceability will depend on how they announce it and what the restrictions or exemptions are, but we expect to hear more when the next announcement is made. Again, we do know that the government has come out and said that they're encouraging all businesses and organizations to very carefully take into account any legal or ethical considerations when developing policies. So, with that in mind, we're very cognizant that not only is there potentially an obligation under health protection orders and protocols and directives, but that COVID-19 is really continuing to create additional workplace considerations and compliance obligations for businesses and organizations under the Occupational Health and Safety Act, labor laws, and human rights legislation. And, it's possible that non-compliance, if it's a formal order, can result in a possible fine or penalty. But it's also true that, what businesses and individuals choose to do can impact on community spread and risk to health and safety. And also that these types of issues can impact on workplace culture and how people feel when they're at work. So it's our opinion that there's no one size fits all for any of this. But as Dr. Strang himself has said, all individuals and businesses do continue to play an important role in helping to manage the health and safety risks that are associated with COVID-19, and also in relation to reopening our economy and supporting local businesses to recover. So it's more important, now than ever, really, to make sure that businesses and organizations fully understand what their legal rights and their obligations are. And with that in mind, my colleague Ian is going to address some of the key legal considerations that he and his colleagues at McGuinness Cooper recommend that you keep top of mind. So with that, I'll hand over to you, Ian.
Thank you, Karen. Certainly, in the last week or so, it's become much more prominent with respect to the issues of employer rights as it relates to this whole COVID-19 and the vaccination question. And certainly many are using the expression of mandatory vaccinations, and we need to understand what that means, again, in the employer context. Many employers are certainly confused with respect to where the province got to this week by saying that in non-essential businesses that you have to mandate, you have to require proof of vaccinations before people can enter your premises. But at the same time, the province is not imposing any declarations as to what the vaccine status is of the employees who work in the business. And the province has been very clear in Nova Scotia to say that that obligation or that question remains with the employee. Remains with the employer. And I've been asked a lot this week as to whether I'm surprised by that. And certainly those of us who practice labor and employment law on a regular basis are not surprised at all by that. I've been saying since March of 2020 that I would be very surprised, if not shocked, if any province or the federal government mandated that a citizen had to be doubly vaccinated in order to be employed. I never thought that would happen, so I'm not surprised by where we've gotten to today. But that still makes it an individual obligation of an individual employer as to how they're going to manage that situation. And certainly, as Karen just said, we certainly recommend that every employer look very strongly at their own workplace and the question of whether or not they should have a mandatory or what type of vaccination policy they should have within their own workplace. I don't believe, as I've said this week, that it's prudent at all for an employer to ignore that question, and everybody has to address it, and certainly in some way. We will get at the end of this presentation to what I expect are all of your questions. We do have a list of the key questions that I'm going to try to answer in this presentation, which I expect are all burning questions in most of your minds. But before we get there, I just need to provide a little bit of a legal background so you understand the basis of where we're coming from on the legal advice. First of all, as Karen said, this is not a one-size-fits-all decision. Different employers will have different policies. Many of you, if you're following this issue at all, will see that Air Canada's come down with an extremely strident policy, as have the major banks, and they're certainly saying that as of a particular date in October, that all employees have to be vaccinated if they want to attend work, or else they'll face employment consequences, in some cases very severe, including termination. And that's where Air Canada's gotten to. But if you're a business that very much can work remotely, your employees can work remotely without any issues or any consequences, then you may well have a different outlook on this. So it is not, everybody's not going to have exactly the same vaccination policy with exactly the same consequences for those who choose not to be vaccinated. If you're unionized, obviously you have collective agreement provisions. But again, one of the most interesting aspects of this whole question is that Canada's largest unions, for the most part, are very much in favor of a policy whereby employees who attend at the workplace need to be doubly vaccinated in order to ensure the safety of all of the employees that are there. So my experience to date is that my unionized clients the unions are being very receptive, if not the ones that are pushing the envelope with respect to the employees who attend at the work site being doubly vaccinated. There certainly are privacy issues which come into play with respect to this whole question, which we'll talk about later on. So certainly, when it comes to an individual's personal vaccine status, we do have to safeguard against that to a certain extent, though the law in that area is ever evolving. But there is some truth to the statement that my personal vaccine status is my medical information and therefore my business. But like anything else in this country, there very much are limits to that. And we will talk about what some of those limits are. I do want to talk about the general legal principles that apply to this whole question of a mandatory vaccine policy and where we are with that, as well as legislation. And it's interesting that there is some analogous case law from past years dealing with the flu vaccine, which certainly can tell most lawyers or give most lawyers a sense of where we're headed on this issue. So if we can go to the next slide, Erica. So with public health legislation, in most provinces, and it depends on your province, but immunization programs are voluntary. That's certainly the way it is in Nova Scotia, and that the consent is required. And what that means, and I guess one part where people get somewhat confused about is that as a general statement, and one of our lawyers at McGinnis Cooper, who's a privacy leader in the privacy law area, has said this repeatedly in the last few weeks. As a general statement, the government of Canada or the provincial government is not able to force anybody to be vaccinated. So we're not nowhere near the type of society where anybody can be forced to have a vaccine stuck in their arm and be vaccinated. We don't operate as a society that way. However, that has completely unrelated, excuse me, to the question of the legality of restricting people's access to certain functions in society for those who are not vaccinated. That's an entirely different question, and certainly given the health and safety issues that are involved, and the very significant health and safety issues that are involved, I would argue, and many obviously agree, that in this country and in this province, we are able to restrict people's access to certain activities for those who choose not to be doubly vaccinated. That's a million miles away from forcing somebody to be vaccinated. Every citizen has the right to choose not to be vaccinated, but they may well be restricted from attending certain activities as a result. And in my opinion, that's completely appropriate and quote unquote legal in this province for health and safety reasons. Why I've been saying quite vocally that I believe that every employer has to turn their mind to the question of what they're going to do about the vaccination status of their own employees is because of the occupational health and safety requirements. And we have to remember 2 or 3 things about occupational health and safety legislation. First of all, occupational health and safety legislation is not simply an employer obligation. It's an obligation by law of everybody who is working in the workplace. So it's an obligation of the employer, it's an obligation of the employees, and it's an obligation of external contractors. They're all very much part of the makeup of the occupational health and safety of any workplace. So it's not just an employer obligation, but the employer, as all of you know, has to take every reasonable and practical step possible to ensure the health and safety of the workers in the workplace. Again, my opinion, legal opinion, is that that means that you have to, given the state of COVID and given that infections are among the unvaccinated, that we have to turn our mind as an employer to how we protect the health and safety of everybody in the workplace, and how we do that in relation to those who are not doubly vaccinated. And I think, as we'll talk about in a second, the science would dictate that the workplace is safer if you the more of your employees who are doubly vaccinated. And so it is an occupational health and safety issue ultimately, and that's what is leading the requirement to turn your mind to what type of vaccination policy fits into your workplace. So the next slide. There just a little bit on the case law. There certainly was a case very early on coming out of Newfoundland that was based on the travel ban. But what's interesting about that case is that the judge in that case went back to the Spanish flu cases from the United States Supreme Court in the early 1900s, and where what is old is new again. The United States Supreme Court said very strongly back in the early 1900s that even though people might think they have individual rights, and individual rights may in some ways be paramount, when the individual rights bump up against the safety and the health of society at large, then the health and safety of society at large has to govern. And that's a U.S. Supreme Court decision. I would suspect quite strongly that a Canadian Supreme Court would follow that logic, and that anytime you have a balancing of interests between individual rights and the rights of the society as a whole that deal with health, that the society rights as a whole are going to win out. And that's what happened in the Newfoundland travel ban case. And the Supreme Court dealt with its own, it talked about the fact that the Canadian Supreme Court has talked about the strength of privacy issues and other decisions, but the Newfoundland case drew a distinction there and talked about the fact that the society interests have to overrule that. And just as an aside, anybody who lives in the unionized world, the KVP case from 1965 is the leading case. And really what it says is that an employer can impose rules on the workplace in a unionized workplace as long as they're not inconsistent with the collective agreement and as long as they're not unreasonable. So even if you have a collective agreement, you can create a mandatory vaccination policy. But as I said, unions almost exclusively have been very supportive of their employers having a vaccination policy. So we'll go to the next slide. So before I talk about this slide and move to the key questions of the day, I just want to give a sense of where we are with the law in Canada. I took out the names of the cases because I'm sure that doesn't really matter to most of you, but where we are with the law in Canada is that back in the early 2000s, there were a number of decisions in Ontario and out west dealing with hospital employees needing to be vaccinated against influenza. So large hospital boards and bodies, like similar to the Nova Scotia Health Authority, were mandating that all hospital employees would need to be vaccinated against influenza, or else they would have to wear a mask in the workplace. So everybody refers to it as a mask or vax policy. And there's literally, almost 100, if not 50 cases reported in Ontario and out west that deal with this question. So there's lots of law on it, and it's not dissimilar to where we are with the COVID-19 vaccine, except that it's exclusive to the healthcare. And the cases basically break down into two different categories. In out west in Alberta, and primarily Alberta and Saskatchewan, the arbitrators all determined that these policies, the mask or vax policies, were legitimate for the employee, legitimate for the employer, because it gave the employee an option that was not a disciplinary option. So, which is what we'll talk about in a second. So where those policies dictated that anybody who A, didn't get vaccinated, or B, refused to mask, then that employee could be removed from the workplace temporarily in a non-disciplinary way until such time as the flu season was over, or the epidemic was over, or until they decided to be masked or vaxxed. But they wouldn't lose their job as a result. They would maintain their employment status, but they would be on a leave of absence without pay, or use vacation or something of that nature. But it wouldn't have a devastating impact in the sense of them being terminated for cause. And the arbitrator said, as long as that was the off-ramp or the outcome, then it was legitimate for the employer to do that. And so A, you don't mask, B, you don't vax, B, you don't mask, then C, there's some removal of your income perhaps, but not, you wouldn't lose your job, and that at some point in time, you'd be able to return to the workplace with your career intact. And that was determined to be a reasonable way for the health authority to deal with it. Ontario was completely a different result, because in Ontario, there was a massive debate about the science. And so the big unions, the nurses unions and others, were arguing very strongly that the science did not really lead to an obvious outcome that masking or vaxing would have a major impact on the safety of the employee in the workplace. And some arbitrators in Ontario determined that the science was just not where it needed to be to make a clear determination on the issue. Obviously, I'm one who would suggest that the science of COVID is much, much clearer, but obviously there are others who differ on that. But that's where the Ontario issues came out with respect to that, with respect to that case law. So in saying what we're saying, we are moving past and accepting the science as it exists, and determining that the Ontario, the Alberta and Western case law is much more a reasonable case law for us to follow, which is why we are giving the legal opinions that we're giving on, which we'll talk about in a second, with respect to how you deal with the consequences of a failure to adhere, employees failing to adhere to your vaccination policies. So coming back to the policy itself, and Tanya's going to talk about how to develop the policies, but first and foremost, you have to look at your own workplace, and you have to do a bit of a checkbox in your own head. One of the questions that we're going to come up in the FAQs is whether or not employees have a right to work from home, which, and I can be quite blunt at times, they absolutely do not. It's up to any employer to determine what the terms and conditions of the workplace are. And if you want your employees to be at work, then you can require your employees to be at work. But the same goes if you want your employees to work remotely and you're totally comfortable with that, that's your right. And in many cases, that has worked out very well. And I keep saying it's one of the most significant legacies of COVID will be the concept of remote work. And in many cases, how successful that has been. So you need to determine, first of all, before you go down the path of a vaccination policy, as to whether employees can work from home exclusively. And I say exclusively because if they do have to attend at the workplace on a periodic basis, or they do have to attend workplace functions on a periodic basis in person, then the vaccine policy has to apply to them. So it's only if they are exclusively remote that you can operate without some type of a vaccine policy. You have to provide options and alternatives, which is the main topic of the FAQs, which we'll come to. You have to respect the duty to accommodate. So as Karen indicated, the provincial government has made this clear that on their vaccine requirements for non-essential businesses, you have to pay attention to those that have a medical reason for not being vaccinated. And if somebody raises a human rights reason for not being vaccinated, medical or religious, then you have to move that offline and deal with that separately, the same way we deal with all human rights questions. It has to be an individualized analysis based on that individual person and whether or not they do have a valid human rights issue, A, and B, if they do, how can we individually accommodate them? So as soon as somebody says, I have a human rights issue or a medical issue or a religious issue, you have to look at that. We're getting more and more questions about religious issues for non-vaccination, of which 90% of the ones we're getting are not valid at all. The provinces raised this question that Karen mentioned in their FAQs about behavioral reasons for not being vaccinated. I'm not sure what that is, unless it's a medical reason in the sense that you have some type of a psychiatric illness that causes you to be very or unable to be vaccinated, which is legitimate if it's medically based. The protection of private health information we'll deal with in more detail in a second when we get to the FAQs. As to the discipline for non-compliance. What's important about discipline for non-compliance is, and what we mean by that, and this comes up in the detail of drafting a policy, but you certainly can have within your policy that if employees refuse to follow the policy requirements, then they can be disciplined for that. That's different than being disciplined for not being vaccinated. But if you choose to have a policy that is a mask or test policy, and the employee refuses to mask, then you can discipline them for not masking. You can discipline them for not providing their test results, because that's discipline for not following the requirements of the policy. And so you definitely can do that as compared to terminating somebody who chooses not to be doubly vaxxed, which we'll talk about in a second. And so if we just move to the next slide. So these are really the 7 questions that I came up with. We came up with that can help you navigate these issues. And then I'll turn it over to Tanya. But so the privacy of medical information versus disclosure of vaccine information, certainly that is becoming more and more of an issue. And so I just want to be very clear on a couple of points that we've been talking about at McGuinness Cooper. First of all, if you decide, and I certainly would strongly encourage you to have a vaccination policy of some type, then obviously in order to enforce that or to regulate it, you need to be aware of the vaccine status of your employees. So I, for one, I do not believe that any employer has to gather a photocopy and maintain a photocopy or a screenshot of somebody's vaccine status and keep it in a file somewhere or keep it on a computer so that you actually are maintaining and having in your possession an employee's vaccination status. I don't see where that is required. employers, in our opinion at McGuinness Cooper, have two options. The first option is a trust option, and we trust our employees all the time to tell us the truth. And so the first option is a trust option where you're very clearly asking or requiring your employees to tell you whether or not they're double vaccinated or not. If they lie, then that brings about much stronger disciplinary responses for lying to your employer. And certainly for internal issues, there's really no reason not to trust your employees. Number two, if you're not comfortable with that, and many aren't, number two would be what I call a checkbox system, in which you simply maintain a checkbox of employees who have shown you proof, in the sense that you've actually seen their Nova Scotia Health a confirmation of double vaccination. And then you just check a box that you've seen it, and then you're not maintaining any documentation about their medical information. You're just indicating that you've seen that they are vaccinated. There is one sort of exception to that, is that a lot of large employers, and I don't want to name names, but some of the biggest employers in Atlantic Canada who have massive on-site operations, they're saying that if you want to come on our site, then you work with us on a regular basis, whether you deliver to us, whether you perform construction on our site, you need to tell us that every employee that you're sending us is doubly vaccinated. And so in those cases where you're making an assurance, one employer to another, that Ian is doubly vaccinated, then you need to see Ian's vaccination status so that you can confirm to your customer that Ian is doubly vaccinated. I wouldn't want you to make that attestation or confirmation without seeing the vaccination status. But other lawyers may disagree with me, but I certainly believe that it's not confidential medical information for you to satisfy yourself through looking at a document that all your employees who are attending at your workplace are doubly vaccinated. So if it's just an internal issue, you have two choices: trust or check the box. I do not suggest, and I cannot see any reason why you would need to keep copies of all of that on your own in your own system or on your own file. That's just allowing arguments to arise about privacy. Number two, can employees who refuse to be vaccinated be terminated for cause? So our answer to that is no. They cannot be terminated for cause. The reason for that is two or three reasons. Number one, the standard for cause is an extremely high standard, as many of you may know, both in the union and the non-union environments. It's extremely difficult to determine or to meet the threshold of firing somebody for cause. And if somebody chooses not to be vaccinated, even though you have a mandatory vaccination policy, it's very difficult. Air Canada, for one, is certainly saying that that's what they're going to do. And it'll be very interesting to see how the law turns out in that area. But all we're saying to clients is that there's a significant risk of you being found liable for wrongful dismissal if you terminate an employee for cause. And the main reason we're saying it's a risk is because this is a temporary aberration, in that it's going to be a temporary issue. So who knows how long it's going to last, but herd immunity and otherwise, it might be 6 months, it might be a year, it might be less. But at some point in time, this issue of double vaccination may no longer come into play. And given that it's a temporary issue, it's very difficult to demonstrate that you have cause to terminate. Now, certainly some of you may be very strong-minded and want to go that way, but all I can tell you is that there's significant risk in today's environment, and given how our courts decide these cases, of terminating an employee for cause who refuses not to be doubly vaccinated. They can be terminated without cause. Certainly in Nova Scotia, as many of you might be aware, we have a special 10-year provision in our Labor Standards Code. So if the employee's over 10 years that may be very problematic. But certainly employees who are under 10 years in a non-union environment, you can, depending on what employment contracts you may or may not have with them, you can pay severance based on the standard common law and labor standards severance principles for under 10-year employees in Nova Scotia who decide not to be vaccinated. You could terminate them without cause and pay them some amount of severance. Do employees have a right to work remotely as an alternative to being vaccinated? That's completely dependent on you as the employer. I would say that they don't have a right to work remotely. I already mentioned that. So absolutely, there's no right to work remotely, but you can decide if it works for your company or not. But as I said, remotely has to be exclusive, because if they're attending the workplace for any reason or a workplace function, then the same rules would have to apply. But it's important to remember, as I've said a few times, nobody has a right to work remotely. But if you choose to go that route, then you can. There's a typo in number 5. It should say, should employers sign a waiver of release if requested to do so by the employee? At McGuinness Cooper, we've seen a number of examples where employees who are completely against vaccinations are printing off a waiver form that they're asking the employer to sign that basically acknowledges that the employer is doing a very, very bad thing to the employee and doing so without justification. And they want the employer to accept responsibility for whatever may happen. We're certainly telling all of our employers not to sign this document. There's a standard document that's you can get off the internet. That is the one that we've been seeing that a number of employees are using, and certainly no employer should sign that. Again, we've mentioned this before, but this is a workers' compensation issue. So if somebody does get ill because the employer required that they be vaccinated, then if that was to happen, the employer is protected by workers' comp anyway. If the employee is saying the only reason I got vaccinated is because my employer told me to do so, it becomes arguably a workers' compensation issue. Question number 6 is a broader policy question that Karen already answered. All I'll say is whether or not the employees at those places have to be vaccinated also is a question for the individual employer. The government stayed out of that issue because the relationship between you as businesses and your employees is your own relationship. You get to decide what the rules are of that relationship if you're in a non-union environment, and no one else is going to impose those rules on you. But you have to pay attention to those issues. So I'll leave it there, and I'll turn it over to Tanya, and then we can deal with the questions as we move forward.
Great, thank you so much, Ian. I'm just noticing time, and I just wanted to let folks know we might just run about 5 minutes over. So if you can stay with us, we really appreciate that. However, if you have other commitments, we certainly understand as well. So in this section, I'm really going to take you back to the basics of developing policy in general. And then I will also layer in some considerations that you need to be thinking about that's very specific to immunization policies. And as my colleague said before, this isn't a one and done. We've had this conversation 3 weeks ago. We may be providing slightly different information, and we know that it's ever evolving and the sand is shifting beneath our feet. So just to, keep your eyes and ears open with respect to what's happening in the weeks and months to come, for sure. Next slide. So when we start thinking about developing policy, there's usually 3 different drivers that lead us to saying, yes, we need a policy. So the first one is that we need to be in compliance. So that would either be compliance to some corporate direction or legislation. And then we move into behavior, and we're looking at, are we seeking to try to change the behavior in our workplace, or do we need to provide some guidance to our staff when they're faced with making decisions? So when you think about that, and regardless of what those drivers are, there's always some questions. Next slide, Erica. There's always some questions that you need to be thinking about as a leader. And I won't go through and read all of these questions, but you will want to think about things like, does a problem exist? You know, are you trying to serve to clarify any ethical, legal, or professional issues that are happening within your workplace? And has there been a change in practice as a result of new technology or advances in knowledge? So you consider some of those questions. And if you answer yes to any of those questions, it's really going to signal to you that perhaps you do need a policy. Other considerations when you're starting to think about policy is also taking inventory of what policies exist within your own organization. So for example, do you have any policies that may conflict with the policy that you're about to develop? Or, you know, do we have to change some policies as a result of developing this one? Go ahead, Erica. I know I'm kind of going ahead and behind you. So from here, we're going to take you through each section. I've broken it down to 7 or 8 different sections of policy development. So I'm going to talk about it from a general perspective, and then I want to layer in that, you know, those considerations that are very specific to an immunization policy with respect to COVID. So the first section is really probably, from my perspective, where a lot of the heavy lifting happens. Most of the work when you're developing policy really happens on the front end, and you'll see why as we move through this. So here we're talking about the policy statement, and it really you know, sets the direction and really tells the employees what the employer's position is. It's important to get your policy statement right and making sure that it's clear and specific, because it also improves your ability to enforce it later and to evaluate it from an accountability perspective, and making sure that it is, you know, effective in achieving what you want it to do. So make sure that your policy tells employees what to do, and just pay special attention to the type of tone when you're developing that policy statement, as well as the style, and try to keep it as short as possible so that it's simple and that people can quickly understand it. So I'll give you an example of that on the next slide. So here, although I said it's short, this is probably as short as I could give it to you today, is for a sample of whatever your organization is, talking about being committed to maintaining a safe work environment and protecting employees and customers from the risk of infection from and complications associated with COVID. And I think Ian referred to your obligation with respect to providing that safe environment. Then looking at acknowledgement of vaccination is recognized as a cornerstone of preventing and decreasing COVID. And then also your compliance around the directions that are being set out from your chief medical officer here in Nova Scotia. So it really sets the stage for your policy that's going to follow in the next number of sections. So here in the definition section, I recommend that you identify what you want to define when you're starting to develop your policy, but then once you finish it, circle back and read through it and ask yourself, you know, is it really clear? And if somebody was a new employee coming into your organization or business, would they know what all of this means? Sometimes we think about common words that may need definition, but pay special attention to significant words that you may need to enforce later. So one of the simple words that comes to mind for me is the term employee. I think a lot of people just assume we know who our employees are, but particularly in this context, and I think I've seen a few questions about this in the Q&A, is, you know, are we considering our contractors or other people that we do business with, are they considered employees? So you really need to understand who's in the bucket and define that, especially with a policy such as the immunization policy. Next section. So besides your policy statement, I would say that the purpose is probably another place that you're going to spend some time in defining. So the purpose is really telling your employees why. Why does this policy exist? I would be really cautious about how you approach your purpose, I would, want you to be as specific and precise as possible. Don't be really vague and general. Make sure that you're very specific in what you're trying to achieve and clear, and make sure again that it's goal oriented as much as you can, so that you really know that, if you're going back to evaluate the policy, has it really fulfilled the purpose of why you developed it in the first place. So let's take a look at what that would look like in your actual employee vaccination policy. So here are just some suggestions. This certainly isn't a final policy, but it gets you thinking about what you might want to define in your policy. So things like your customer, who your employees are, like I mentioned earlier, immunization, personal protective equipment. So those are some of the definitions you might want to think about. And then a purpose might be simply to protect employees and customers from COVID by preventing the transmission and decreasing the risk of COVID outbreaks. You may go further if you're one of those organizations where there's high risk, such as airlines or health. You may be looking at some national guidelines that are going to, that you need to provide compliance to. So you may add that last sentence if that applies to you. So section 4 is really about, who does this policy apply to? And I think there's two parts to this particular section. I think you're asking yourself, who does it apply to? But also, and equally important, is who does it not apply to? There was a question in the chat about, does this apply to volunteers? So there's lots of different scenarios that you need to turn your mind to when you're saying who does it apply to and who it doesn't apply to. And again, if you wanted to just advance the slide, Erica, you can see here that, oh, sorry, I thought we were going to another slide. I'll do this one and then we'll see what it looks like as far as application. So here in the procedures, I wouldn't normally be suggesting that you put any procedural information in a policy document, because a policy really is telling your employees what is the position of the employer, where procedures are really the how is it carried out, what are the steps that employees need to follow, and they're typically two separate documents. But in this particular case, I would recommend that you put some information in from a procedure perspective, because it's a new policy. Employees are probably just wanting to go to one place to get the information that they need. And as we work through this and, the months and years to come, we'll be able to further define and separate both the policy and procedure. So now the next slide will tell you a little bit about a sample of the application as well as the procedure. So in the application section, you're really saying the policy relates to all employees of my organization. And we've already defined what or who an employee is. But remember, you're going to be thinking about, does that apply to contractors? Who doesn't it apply to? Are we including those that are visiting our business, our shoppers, our clients, anyone who's coming in as a visitor to our business? Are they included? So it's who and who not is the policy applying to. And then from your procedural perspective, you're going to have some information around accountabilities, and accountabilities in your procedure is really from the broad down into the specific. So you may be looking at a CEO who is responsible to ensure that the policy is in place. But when it gets down to the very specific, say, employees, they're looking at, are they responsible to show their manager proof of vaccination? Are they required to wear PPE? All of the specifics around their compliance to the particular policy. And as well, what are managers' responsibilities under the policy? Are they required to monitor, as Ian said, a checklist of employees who are showing proof of their vaccination? And or are you going to, and against Ian's advice, are you requiring them to provide you a document that you're going to store as proof that they were vaccinated? So next slide. In the monitoring section, it's really, in a policy, you don't want to develop it for the sake of developing a policy. I know that right now we're faced with the situation where government has said, it's up to businesses to develop their own policy. I recommend, if you're going to go through the work and think through all your scenarios and your position on this particular topic, that it needs to live and that you need to ensure that you're monitoring compliance to this particular policy. So you just don't want to develop it for the sake of developing it. You want to make sure that people are following it. So you need to understand who is going to be responsible to ensure that the policy is being monitored and how often the policy is going to be monitored. Finally, I would identify any of the material that you've used to consider developing your policy. So when you sit down to develop your policy, it's not just based out of your own mind. You're going to be looking at all kinds of different sources and resources for you to get to the conclusion and the position that you're going to take with respect to immunization. So some of this may come from other policies that you have within your organization. You're also going to need to consider what are some of the provincial and or federal legislation. Also, if there's any guidance from national organizations, and also, within the province of Nova Scotia, what is your public health office providing as far as guidance. So there will be a number of different sources that I think you'll be considering as you determine what your policy is with respect to immunization. And it really does provide credibility for your policy to your employees. So here's just an example. If we kind of layer in what the employee vaccination policy may look like, it's your HR manager or your manager of safety or your CEO, whoever you determine is responsible. I have here every however many years. In this case, I really don't recommend you don't look at this for a year. As you know, this world is changing fairly quickly. So I would suggest you're looking at this every couple of months, or as information becomes available to you. That's different than when you develop the policy at the beginning. And then also looking at your management team and how they're going to be monitoring the compliance to that immunization. And again, it goes back to Ian's point around, are you taking the position of trusting your employees? Are you doing a checklist? Are you doing forms or some type of paper trail? So however that shapes up for you, that needs to be defined. And so that accountability for the compliance to the policy is built in here. And then I just offer a number of different resources. It's certainly not exhaustive, but it gives you a sense of places where you might want to go as far as getting some reference material and developing your policy. So I said finally after section 8, but I guess I lied because we have one more, and it's just your appendices. And again, this may or may not apply to your policy. You have some templates or forms or any additional information that you may want to provide. I've seen some businesses where they had some information that came out of the Chief Public Health Office that they wanted to include for their employees as educational material, and they wanted to include it as an appendix. The only problem with doing that is that that information quickly becomes outdated. So you'll have to have somebody, with their mind to replacing that information. But whatever types of forms that may support or material that may support your policy, you could certainly put that at the end of your policy. So I'm going to just quickly, just wanting to make sure that we have some time for some questions, is just take you through what the policy may look like based on all those sections. So here, for sure, you're going to have that identification information up top, and then your policy statement. And again, the policy statement, along with the definitions, you've now looped back and you've read your policy again. You've identified what definitions you want to include in your policy. That's really going to set the tone for your policy for the reader. And then moving on, you can look at your purpose statement. If you want to just advance the slide there, Erica. The purpose statement, which is really your why. Does the policy exist? The application is really for whom, and the procedure is the how. So you work your way through, and then you end off your policy with how you're going to monitor it and what references are available, so people know that it has been developed with, you know, good sound evidence. So that's really in a very quick manner to be able to provide you the general approach to how you develop policy, and then how it can be specifically applied to your vaccination policy in your business. So before we hand it over into questions and answers, I just wanted to take a few moments to say that there's other things that you do need to be thinking about with respect to COVID. One is around that acknowledgement of immunization, back to the point of how management will know that employees have been immunized, so give some thought to that. Also around working from home and remote working. I know that we all responded very quickly to the pandemic, and now that it's becoming more normal, if you will, and businesses are thinking about how do we work, you know, continue to work through with COVID and post-COVID. The whole idea of hybrid workplaces are coming to light. So there's considerations around privacy, who can work from home. So for example, you know, people that are just starting with your organization, is it okay for them to work, or do they have to spend 3 months in the workplace and then, you know, build that trust and rapport and relationship and then go home? How do they circle through from being home and into the and back into the workplace? And also thinking about your obligation from an OH&S perspective, and knowing that both the employer and the employee both share that responsibility. So how is that maintained at the office work site and at the home work site? So things to think about when you're moving forward with COVID. Also, respectful workplaces. I would just highlight that, you know, our first presenter talked about, you know, a lot of the hate that is out there, and that certainly comes into our workplace as well. And we have, you know, a bit of shame that's happening with respect to people who choose not to or can't be vaccinated. And so I think if you don't have a respectful workplace now, you need to be turning your mind to putting that in place to ensure that that engagement and that civility still is maintained within your workplace. And then also I'll just end on like paid sick leave as a one that I'm sure that you've all thought about, but still moving forward. And we have individuals who will be symptomatic of COVID symptoms. What are you doing as far as, you know, sending them home? Is that paid? When they're confirmed, do they come back to work? If they're not confirmed, do they come back to work? Who's paying for what, and how is that all going to be handled in your workplace? So there's a number of different considerations outside of just the immunization that we've talked about today that I think businesses still need to continue this conversation forward. So I'm going to end here because I'm out of breath. And thank you very much for your attention over the last almost 90 minutes. And I know that we've been looking at some of the questions coming in, and I'll turn it back to the chamber to maybe facilitate some of the key questions that we can answer for you before signing off.
That's great, Tanya. Thank you. If we could just get everybody to turn my video back on. I can't do it. But thank you very much. There are lots of questions I see. I see folks have been going in. Ian particularly has been going in and answering questions as we've gone. So that's great. Thank you very much, Ian. Just a couple of quick snappers. Will the presentation be available for us to send out after? Okay. I think that also answers, there's been a number of questions about, do you have a template for the policy? I think Tanya has provided us a template. So this is the template. You're not going to get another template. This is the template. So I would encourage you guys to take a look at this and to follow along. Just to be specific on some of these questions, and again, I'd love to try to get through them quickly. I know sometimes they may require longer answers, but Sarah's asked. She runs a business that is a co-working space, so it's a number of different businesses in one location. How will she deal with that?
Thanks, Patrick. I will answer that question, but I just wanted to try to deal with some of the questions that have been coming in. I did neglect to be very specific in my presentation as to what my recommendations are as to what you should have in your policy, and that's raised some of the questions here. So as far as what McGinnis Cooper is recommending, certainly I'm recommending be in your policy, is that you really have three. I think you have three options to consider as your outcome. One of them that people have been talking about is your quote unquote mandatory vaccination policy should mandate that those who are not doubly vaccinated have to mask and or be tested on a regular basis. That's option one. Option two would be to anybody who's not doubly vaccinated by, let's say, October 15th, November 1st, would be placed on a leave of absence without pay. That's option two. We're very comfortable with that option for a number of legal reasons, but you could move to that option. That is putting the onus on the employee to do something, or else they're on a leave of absence without pay. Number three is termination, which we're saying we have a lot of concerns about, but those really are your three options. One is testing and masking for those who don't get vaccinated. Two is a leave of absence without pay, which is where we're suggesting what you should consider. And three is termination, which we're saying is too risky and not recommending. The one question I wanted to answer before I deal with Sarah's is that immediately you should move to, in your hiring processes, people ask this question a lot, you certainly can require double vaccination as a prerequisite to employment. So unless there's a human rights reason as to why they're not doubly vaccinated, then during your hiring process, you can say, if you want to work for us, you have to be doubly vaccinated. There's no human rights reason in asking the question. There's no privacy reason in asking the question. But if they have a human rights answer, then again, you're going to have to consider that. As far as shared workplaces, a number of people have asked this question in different ways. Very, very difficult. Your job as an employer, whether you're dealing with volunteers or workers, is to protect your own workforce. So even if you're working in a shared space, you should be taking whatever steps you deem appropriate to deal with your employees and your volunteers. So even though you're having a mandatory vaccination policy and the person next door in the shared space isn't, that doesn't mean that you shouldn't have one. So my recommendation is that you need to do what's best for your employees and your volunteers. It's unfortunate that your space share is not doing the same, but you should certainly do what you can to protect your volunteers and your employees. Somebody asked the same question about a large office building where not all of the employers are doing the same thing. My answer again is the same, which is that you should make your own decisions as an employer and push that in your own direction. But moving to one of those categories that I mentioned is, I think, where all employers have to go. And somebody's raised the question about if an unvaccinated employee needs to wear a mask and be regularly tested, isn't that pointing out to everybody else what their status is? I get that question all the time, but the answer is really that that is a reasonable accommodation for their medical status, and that's all you're obligated to do as an employer is come up with a reasonable accommodation. If they don't like how that's impacting them, that doesn't make the accommodation unreasonable. So that's still a reasonable accommodation, and there's no other way around it. unless they want to take a leave of absence without pay and not come to work, then the only way they can be at work is to mask and be tested, and that's your reasonable accommodation.
Okay, a couple of quick snappers here. What about individuals who don't want to be vaccinated due to religious reasons? Speaking to the province the other day, they said there's very few religions that require or don't allow vaccinations. What do you think?
Well, absolutely. I mean, I see the question here, and we had it come up in our office yesterday. I mean, we had someone tell their employer yesterday that they were Christian, and for that reason they couldn't be vaccinated. But that's not part of the Christian teachings. So you do need some type of a document from the religion that demonstrates that it absolutely is contrary to the religion. Employees are just saying it now in some cases that they're basing it on religious grounds, but like any request for accommodation, the employer is entitled to ask much more detailed questions and to pry and prod a little bit more to determine exactly what the basis is for the request and require pretty definite proof that, but as the province said, and what we're seeing every day, there's very, very few religions that would actually mandate in their doctrine that the vaccination would be outside the religious beliefs.
Okay, I see Tanya and everybody's been answering questions madly directly, so I'm not going to, I see we're running out of questions, which is wonderful. Just accommodation. So if people insist on being tested instead of vaccination, if you're going to allow that at your workplace, do they, can you suggest that they do that outside of normal business hours?
Become vaccinated? Yeah, sure.
Well, sorry, get a test. So come in at 8:30 for a test for a 9 o'clock start time.
Yes, yeah, absolutely. If your policy is, if you want to go with a policy that's mask and test for anybody who's not double vaccinated, then absolutely, Patrick, we get that question all the time. It's the employee's obligation under that scenario to show up on Monday morning and Wednesday morning with a negative test result, and they have to get that test outside of work hours.
Okay. The chamber, I mean, we were going to allow tests if you weren't vaccinated. We've now changed our policy to insist that people be vaccinated because we go into businesses and the province has just said for non-essential businesses, you need to be vaccinated, and our employees go into those businesses on a regular basis. So are we okay with our policy now insisting that people need to be vaccinated because the province has insisted that people need to be vaccinated to go into non-essential businesses?
Yeah, sure. Absolutely. In the last 48 hours, a lot of my clients that were leaning towards the mask and test option are now moving towards a more strident policy that is saying if you're not double vaccinated by October 1 or October 15th, then you're going to have to suffer some consequences, likely some form of a layoff. Most of them are moving in that direction because the mask and test one has too many moving parts associated with it, and it places an obligation on the employer to monitor it. But that's just some employers. Certainly, the mask and test is very much an option that's available to you, but your policy of mandating it because of the businesses that you're going into is very legitimate.
Okay, perfect. Melissa asked a question, but I'm afraid I don't understand it, Melissa. Maybe it refers to one of the parts of the presentation. If a customer requires vaccination and wants proof rather than a checklist, how do we handle this? Do you guys understand that?
I totally do. That's a great question. Okay. So that's a big provider saying to their contractor, if you want to come on our site, then you have to provide proof that your employees coming on our site are vaccinated, and your word's not enough. So we're struggling with that one here because we believe that Melissa saying to X big company that she has verified that all the employees going on their site are vaccinated should be enough for them. But if they require proof, our advice is to go to the individual employee involved and say, X company requires proof for you to go on their site. So are you comfortable with us giving them proof of your status so that you can go on your site? And if you're not comfortable with that, then you're not going to be able to go on that site, and that may impact where we assign you or whether you're assigned at all. But go go back to the individual the individual employee and have that conversation with them, and even try to push back with the other side and say, I can guarantee you that they're double vaccinated, but if that doesn't work, then you got to interact with your own employee and let them decide.
Okay. Angela has asked about time off for testing. I think we've covered that, which is employees can be asked to test during their time off to arrive at work while they're fully tested. But
I would say, Patrick, Angela makes a very good point that if you want to go with mask and testing for those who don't vaccinate, then your policy needs to address the issue of testing and whose responsibility it is and when it needs to take place.
Right. So when our policy was going to involve testing, it said people had to show up 30 minutes early. It said they could do it Monday, Wednesday, and Friday, and they had to do it in a supervised setting. So we were trying to be very specific, and frankly, we were trying to make it difficult so that employees would be vaccinated. Okay. So another question, risk levels in an office versus a childcare setting. So if, let's say it's a daycare, they have an office environment, they actually take care of the kids on the main floor. Should there be a different policy, or is it better to have one policy?
Yeah, I mean, I think it's better to have one policy that applies to everyone. I mean, as I say, we're pretty confident that either a mask and test policy or a leave of absence without pay kind of layoff policy for those who aren't double vaccinated, we're quite confident that both of those will withstand some type of scrutiny. So once you should pick between one of those two for your entire organization.
Okay. Jackie has asked about family doctors and uses only walk-in clinics, so don't have a record. So to be clear, everybody has a record if you got your shots in Nova Scotia. And if you go to your record, which you can do, it doesn't show the little card that's at the bottom, but it's at the bottom if you print it, right? So you guys have probably seen those.
Absolutely.
Yep. You can, when you hit print, you will see a vaccination record at the bottom of that page. So you should print it and have that there.
Can I just interject on that? There will be some challenges to that with some of our university students who may live at a province who are vaccinated at a province. So access to that proof may look different. And so there needs to be some consideration around that as well.
Okay, so Jackie has just clarified, which is it's not for vaccination records, although you know how to get them now. It's for medical history for exemptions.
Yeah, so I mean, that's a fairly straightforward answer. I mean, any employee who is asking for an accommodation is required by law to provide the medical proof for the accommodation. If they can't provide it, then you have no obligation to accommodate them.
Right, so it's up to them to figure it out.
It's up to them to figure it out. And Sarah, going back to my other question, my other answer is saying the client doesn't allow for that accommodation. So in that case, you're going to have to go to the individual employee who's supposed to go to the site and say to that employee, are you willing to have your provide me proof of your vaccination status so that I can give it to the client. If the employee says no, then you're going to have to deal with that employee or overrule that employee. That's a difficult question, but most employees will say, sure, go ahead and tell them I'm vaccinated.
Okay, perfect. Okay, I'm going to stop it there. I think we've got through all the questions. I know you've answered and typed and all kinds of things to get through the questions. So I think we've covered everything. This will be available on YouTube. Thank you all for presenting. So thank you, Tanya, Karen, Ian, Karash, for your time and knowledge today. This is the hottest topic that we've run in a while, and I can tell you we're getting a lot of questions on this. So really appreciate you putting this together. Really appreciate, Tanya, you presenting sort of what a policy would look like. We'll send out the presentation and we'll make the link available. We do have a few more webinars this month focusing on transferable skills, employee engagement, and we have a big event, Small Business, Big Growth, happening on October 22nd. This year's theme is strategy and will involve interactive planning. So I'm doing a commercial for the future. Thank you very much, everybody. And thank you, MC Advisory, for this great insight. Your emails and things were up there. So if anyone has any additional questions, I would encourage you to reach out to our guests today. Thank you very much, everybody, and have a good weekend.
Thank you very much.
Thank you.
Bye-bye.
Bye.
Thank you.